Welcome, everyone. Thank you for joining us this afternoon. This is the Hemophilia Council of California's Advocacy and Public Policy webinar, Choose Smart, Don't Be Overwhelmed by Your Healthcare Choices.
Over the last 2 decades, there's been quite a bit of work to try and create a seamless system of insurance in California. So we didn't have as many people uninsured. In doing so, part of that was the Affordable Care Act, which in California has covered California, the marketplace. There's Medi-Cal, which has gone from a fee-for-service program when I used to work for a couple governors ago to much more of a managed care organization. And we're going to see more changes this year as Medi-Cal moves some of the more fragile children's services programs and others are going to be moved more into managed care, and they're going to make some changes ostensibly to be better for everyone. But it's always worrisome that as those changes are made to make sure that patients don't fall through the cracks and that people can still get their medicines. So we'll see CalAIM be implemented in the next several years. That'll be moving more children with hemophilia and other blood disorders into managed care programs. And so again, making sure that you're a super smart consumer and choosing the right plans and then fighting for the care you need is going to be really important. So Medi-Cal serves about almost 13 million Californians. It's like a third now. And because of the way Covered California has been structured, Medi-Cal doesn't quite have the stigma it used to, which is nice that people can join Medi-Cal, and as they go into work and their income increases, they transition to one of the Covered California plans. And so the goal is to create a seamless system so we don't have people becoming uninsured. Medi-Cal is supported by both federal and state dollars, and it's an income eligibility. So it shouldn't discriminate against anyone. But it does have rules about what it'll cover, just like the private insurance. Medi-Cal only pays for prescriptions that are on the list of accepted drugs. So if you might need to get a prior authorization to get that. It does not cover cosmetic surgery and things. And I know that there have been struggles over the last couple of years with what Medi-Cal will cover and won't cover, and discussions about if, cosmetic surgery is really cosmetic, or if it's a birth defect and we're correcting it, should that be covered? So it's, there's an ongoing push and pull about getting everybody covered with as much coverage as possible. If you're approved for Medi-Cal, you get your health insurance coverage through a managed care plan. Could be a Blue Cross Blue Shield. You have choices. A Molina Healthcare. Throughout California, most counties currently have what's called a 2-plan model. So you can choose between usually a local program and a commercial provider, which is wonderful, gives people choices. Because again, you should be thinking about location. Where is it? Can I get to the doctor's office? Do I like my doctor? Do I need to, can I ask around who has a good doctor so that you're comfortable going to see your physician? Right now, there's some discussion in Sacramento and San Diego counties. Those 2 counties are very different, and they were created differently. They have 6 or 7 different health plans that are all competing and offering services to Medi-Cal recipients. Going forward, it looks like the state wants to eliminate some of those plans and go down to just 2 plans. So there are a lot of advocacy groups that are a little concerned that people are going to lose their coverage coming up if they're with a certain plan and then that plan doesn't move forward. So again, being aware and kind of in touch with your health insurance and with organizations like Lynn's, that make sure that the advocacy is there and the information is there. Make sure that you can get your continue to get your coverage if you need it. So Medi-Cal, I talked a little bit about. There's Medi-Cal for individual families, for children, for pregnancy. Let's talk about next slide. Talk a little bit about Medicare. And I do know that some folks in the hemophilia community, because of income and disabilities and access, are we used to call them dual eligibles, but I think, Lynn, correct me, but I think they're DSNPs now, or the terminology changes always. But it's a way that both Medicare and Medi-Cal are working hard to ensure that people who need care get that specialized care. So Medicare is the program for anybody over the age of 62, I believe, although there's always discussion about where to change that. And also for those who are income eligible or have disabilities that need to be on Medicare as well. Medicare used to be just straight hospital coverage, and that was Part A. Several, I don't know, say 10, 15 years ago, maybe 20, Congress created Medicare Part B, which is known as more the medical insurance instead of just the coverage. So that covered outpatient care and home health care and durable medical equipment, other really important, obviously, services for that population. And then most recently, Medicare Part D was created, and that's the prescription medicine program. And so when you read the newspaper or see discussions about federal government, Congress talking about prescription drug coverage, it's typically that Part D, which has been added to the original Medicare. And so some people choose to purchase like a Medicare Advantage plan, which is a Medicare Part C, to make that even more complicated, to cover prescription drugs. So we like to call it like it's a managed care policy for Medicare to cover your prescription drugs, so you don't pay the cash price when you go to the pharmacy. And remember now that if you brought an insurer in to help manage that, there are going to be restrictions on what's covered and what's not. So please, when you go, if you're going to go look for Medicare Advantage plan coverage, there are organizations such as HICAP, which is the Health Insurance Counseling and Advocacy Program statewide. And there's county by county, their contacts. They can help you actually work through which plans are best for you. And so again, there are lots of different sources out there. You don't have to go it alone, because you need to make the right choice for you and your family.
And Kassy, I'm going to pipe in real quick and just say too, we're going to also be doing a full webinar just about Medicare in November as part of this webinar series with some experts in sort of how bleeding disorders care kind of connects with Medicare and what people need to be concerned with when they're transitioning from whatever their current insurance might be to Medicare.
Excellent. That's excellent. I'm glad to hear that. We get caught more in the Medi-Cal and private insurance,
exactly.
struggles. So it's excellent.
We thank Kassy again for joining us for this great information. We will put the links on our website along with the video when we have it completed. And we really appreciate everyone joining us today. Thanks so much. Well, we will see you next month.
Thank you, Lynn.
Thanks. Bye-bye.